Top 10 Dermatologist Skincare Advice. Are you aware that every day, your skin sheds roughly 40,000 skin cells? Skincare advice provided by a dermatologist. 1. Wear sunscreen every day. According to Dr. Ketterpal, there are just 20% fewer UV radiation on snowy or foggy days compared to a sunny day. That visible light can degrade our skin, the author says, even when you're driving or sitting near to a window. 2. Check your skin for cancer every month. Skin cancers are on the rise. With more than 5 million new cases identified each year, skin cancer is the most frequently diagnosed malignancy in the U.S., according to the American Cancer Society. According to recent studies, 1 in 5 Americans will develop skin cancer at some point in their lives, says Dr. Ketterpal. A majority of those cancers are sun-related. Skin cancers can also be exacerbated by tanning, so Dr. Ketterpal warns against certain misconceptions. You don't need a base tan before vacation. Some people think that in order to prevent burning, you should get a tan before spending the day in the sun. The chance of developing melanoma increases by 4 times for each tanning bed visit, Dr. Ketterpal explains. If you want a tan, get a spray tan. You'll still get a tan if you use sunscreen. Many people avoid using sunscreen because they are concerned about getting a tan, but in reality, using sunscreen will not prevent you from getting a tan. 3. Moisturize your skin. Our skin dries up, gets more sensitive, and is more susceptible to irritation as we age because the oil glands in our skin are less active. Moisturizer is meant to pick up the slack and keep your skin soft and healthy. To seal in the moisture and keep your skin moisturized, Dr. Ketterpal advises applying a moisturizer 3 minutes after getting out of the shower. 4. Stop smoking. Beyond your heart and lungs, smoking can take a toll on your skin. Smoking can stress skin cells and cause your blood vessels to narrow if you don't stop. 5. Acne isn't a hygiene problem. If you have acne and think you're not washing your face enough, you might want to reconsider how you think about your routine. Acne is largely genetic or hormonally driven, says Dr. Ketterpal. It is unrelated to your personal hygiene practices or how frequently you wash your face. 6. Don't pop your pimples. Yep, you did read that right. You may be tempted to burst or squeeze a pimple as soon as you notice one on your face, but you need to resist the desire. Dr. Ketterpal issues a warning. If you pop it, you could introduce an infection and make inflammation worse, which could lead to further scarring. The best course of action is to let zits alone and spot treat them with a topical benzoyl peroxide cream. 7. Use a daily topical antioxidant. Whether we're inside of our homes or outside, we expose our bodies to a number of pollutants every day. A thorough analysis of these contaminants reveals that organic substances, heavy metals, gaseous pollutants, and elements from the Earth's ozone layer all have a direct effect on how well our skin barrier functions. 8. Stay away from products with fragrance. We all enjoy pleasant fragrances. Therefore we always take advantage of the annual bargains on floral bath and body items. But scent might really do more harm than good because it dehydrates your skin and increases your risk for allergies, rashes, and dryness. According to Dr. Ketterpal, many moisturizers have so much smell that even though you're trying to add moisture, the aroma really works against you. 9. Avoid using oil on your scalp. Utilizing carrier oils like argan oil and essential oils like tea tree oil has been popular for a time. It's recommended to avoid applying these straight to your scalp despite the fact that they have a number of advantages, including the ability to cure wounds and reduce inflammation. 10. Use bare-bone ingredients. It can be challenging to decide which skincare products to use and which ingredients are ideal for you given the abundance of options available. The best course of action is to stick to moderate skincare regimens that incorporate the fewest substances possible. Those ingredients should also be natural. Without fragrance, extra preservatives and all these other things. You want to use bare-bone ingredients to serve a purpose, whether it's moisturizing, cleansing or using sunscreen, says Dr. Ketterpal. Dr. Ketterpal urges patients to contact a dermatologist if their condition hasn't improved after trying easy fixes and avoiding goods they might be allergic to.